Hello, everyone, and Happy New Year. I hope everyone had a safe and restful holiday break. The first few weeks back have been challenging for all of us with a number of individuals testing positive for COVID-19. The impact of this is being felt on our operations as a faculty as we have a lot of on-site activity due to the nature of our teaching and research. In our continued efforts to keep our faculty, staff, and students informed on our approach to COVID-19, I'm here to present to you today several updates. So we're going to go ahead and get started. So the COVID-19 situation globally has been impacted by the highly contagious Omicron variant. As a result, the COVID-19 case count continues to rise globally and provincially. So over 335 million cases worldwide confirmed of COVID-19, 2.8 million in Canada. Within the province of Manitoba, there's 111,432 confirmed positive cases, 1,466 deaths, 69,161 individuals have recovered from COVID. There are 588 people in hospital with active COVID-19, 46 which are in ICU. Our provincial test positivity is at 34.2%. The current public health orders are in effect until February 1st, 2022. The universities actually fall under businesses in the public health orders. And throughout the pandemic, the University of Manitoba has taken a more conservative approach throughout the pandemic on capacity, PPE, and screening. And so as of February 1st, we'll see what impact or changes that will make to the university with any changes in public health orders at that time. So just a quick update on the vaccination status within Manitoba. So far, 2.6 million doses of vaccine have been administered. Those with 3 doses, that percentage is 35.8%. So continues to be a bit lower as people become eligible for that 3rd dose. We have sent encouraging emails to students and faculty and staff to encourage them to get their 3rd dose when they become eligible. 70,000 doses have also been administered in the Manitoba First Nations communities, and this work has been supported by Unvaccinated Health Services. Unvaccinated Health Services, with the support of Rady Faculty of Health Sciences, has played a critical role in the COVID-19 response in First Nations communities. In spring 2021, we onboarded 300 individuals to administer 1st and 2nd doses of COVID vaccinations in First Nation communities. The rapid response team continues to provide support to communities in managing outbreaks. Health workforces are being heavily impacted by Omicron in the First Nations communities. Unvaccinated Health Services is projecting 63 communities will need support in the upcoming weeks. As hospitals within Winnipeg and across Manitoba plan for increased COVID-19 admissions, other slowdowns of services, for example, surgery, may provide opportunities where learners may be able to assist in the First Nation communities. Supports will be needed in the areas of primary care, emergency care, testing, and vaccination, just to name a few. A memo specifying the above was circulated through our Dean, Dr. Brian Postal, and has also gone out broadly to senior leadership within Rady Faculty of Health Sciences, asking for senior students and residents to support the efforts within the First Nations communities. There will be remuneration available for activities that fall outside of curricular time, and any interested individuals should contact us for more information. So in fall of 2020, at the University of Manitoba, we started reporting on positive cases of COVID-19 on our campus and placement sites. So a positive case, just as a reminder, is when an individual has been on campus and tested positive. So they've been either symptomatic on campus or they've been on campus within their period of communicability, which is 48 hours before they test positive. So those cases are reported here. So there's been 118 in Rady Faculty of Health Sciences in total, 14 in dentistry, 71 in medicine, 78 in nursing, 4 in rehab sciences, and 2 in pharmacy. So these numbers are reported through the programs as well as through occupational health and safety through the shared health facilities. So as you can see, the highest numbers are being reported in medicine and nursing. They also have the highest student intakes as well. In fall 2021, the president communicated with the university community that we would have a full return back to 100% activity for winter term 2022. In late December, based on new information and the Omicron variant, the university decided to continue with remote teaching and learning where possible until February 26, 2022. A decision on how to proceed after that time will be made closer to that time. At this time, I'd just like to acknowledge the efforts of all of our staff and faculty who had to quickly change plans for winter term, being 100% in person to being remote wherever possible. So given the very short notice that we received and the fact that our winter term in Rady Faculty of Health Sciences starts as soon as January 4th in some programs, this was a large effort for those staff and faculty to take on, and they were able to accomplish it. In Rady Faculty of Health Sciences, on any given day, we have about 1,500 people on site. This is still a fair bit of there's still a fair bit of on-site teaching and research. So in an effort to provide a safe learning and work environment, we implemented in-person COVID-19 symptom screening. So as a reminder, anyone that is coming onto the University of Manitoba campuses should be self-screening before attending campus. We felt there wasn't consistency in this approach. And so given this and the more contagious nature of this variant, we reinstituted in-person screening at the entry point locations. This will be in place until February 26th, at which time we will review that approach. So anyone entering our campus now, so as of January 5th, is not required to provide proof of vaccination. This is due to the fact that we've been able to cross-reference the lists of people that have been vaccinated with those that have access to the campus, and those that have not declared their vaccination status and don't have an approved, have not declared the vaccination status are being redirected to the rapid testing sites only for entry onto our campuses. So as of January 5th, our PPE requirements for on-campus activities have changed. There was a recommendation made by the Health and Safety Committee that due to the contagious nature of Omicron, a KN95 mask should be used. A KN95 mask has a tighter seal, and when worn in a non-health setting, i.e., for example, in our skills settings, KN95 masks do not require fit testing. So that is helpful because we wouldn't have the capacity to fit test individuals either with the machinery or the available individuals with this training to be able to do that. The key point here is a KN95 is not medical grade. The masks that we have purchased have undergone safety testing and are from a reputable supplier where we have a long-standing relationship with. And so typically our PPE requirements at the University of Manitoba, specifically in Rady Faculty of Health Sciences, have been made in consultation with the health system. However, for the KN95s, this wasn't the case. So therefore, KN95s are not approved for use in shared health facilities. So when students and any staff are within the healthcare facilities, they need to be wearing the masks that are provided within that facility. So KN95s are at the University of Manitoba campuses should be used in all academic and research settings within the campus. We've kind of made that general distinction because in conversations with college leadership, most of the activity that is happening on campus is that where physical distancing can't be maintained. So where physical distancing can't be maintained, eye protection is also required. Physical distancing must be maintained in all the common areas and the office areas at all times. And in order to facilitate this, we have asked individuals to work remotely where possible. So the University of Manitoba has implemented a mandatory vaccination policy for anyone on campus and in placement sites. So as of January 24th, anyone that hasn't declared proof of vaccination cannot access the campus or placement sites. If an individual is in process of becoming vaccinated or has an approved medical or religious exemption, they can continue to access the campus with rapid testing. So I'm currently working on a plan for the University of Manitoba as a whole on how to operationalize this, and I'll communicate that information with those individuals as soon as that's been finalized and approved. So by extension of the above, All contractors on our campuses and vendors need to be fully vaccinated. The U of M has communicated this to all companies that we deal with, and it is up to the company to ensure that they are sending us fully vaccinated individuals. As an additional measure in Rady Faculty of Health Sciences, anyone entering our campuses that doesn't have swipe card access is required to provide proof of vaccination in addition to doing the entry point screening. As previously communicated by the University of Manitoba, research participants can be unvaccinated. However, it is up to the PI to access rapid test kits through the Rady Faculty of Health Sciences operations team and coordinate rapid testing of the unvaccinated research participants. So on the subject of research, research capacity has not changed formally through the University of Manitoba. In Rady Faculty of Health Sciences, we did ask research faculty, staff, and students to reduce activity on campus where possible and stagger their shifts. During the discussions of the KN95 masks, we heard strongly from the researchers in Rady Faculty of Health Sciences that physical distancing was not possible in the labs, and therefore we have made KN95 masks available to the research faculty, staff, and students within Rady Faculty of Health Sciences. We have run into a bit of an issue where our research staff, faculty, and students are in a health facility. So I mentioned previously that KN95 masks are not approved for use within the health facility. And so we are addressing this issue. And one way to resolve this would be to have the research staff, faculty, and students in the health facility use the health system provided masks in the common spaces and only using the KN95 masks within their labs. All staff and in offices and cubicles should be wearing level 3 medical grade masks. Those are the masks that are provided when individuals are entering the campuses. If additional masks are required, again, you can access them through the same way you have been throughout the pandemic by contacting Rady Faculty of Health Sciences operations. Rapid test kits for asymptomatic or serial testing are being provided through Rady Faculty of Health Sciences operations. There is limited supply. Supply chain issues will only continue to grow as the health system leverages rapid test kits for their own healthcare staff as well. Based on this, we are asking units to provide plans on how they will be using the rapid test to ensure that it makes good sense and also is consistent across Rady Faculty of Health Sciences. Rapid tests are not available for symptomatic testing at the University of Manitoba, so our rapid test kits should not be made available to individuals that are symptomatic. First of all, symptomatic individuals should not be on campus. They wouldn't be meeting our screening protocols. They should be directed to the provincial testing sites. Should an individual become symptomatic while on campus, it should be the same procedure. They should be directed to the provincial testing sites and follow directions from that site. HSC has sent us a communication just yesterday that healthcare staff working at HSC, this does include residents, will have access to rapid test kits at HSC should they become symptomatic. So I'll review this a little bit later in the presentation. And we have reached out to ask if this also applies to our students at HSC and if all shared health facilities would be moving in this direction as well. So now I'd like to spend a bit of time on ventilation and HVAC and our approach to this at the University of Manitoba. So throughout the pandemic, we have referred to ASHRAE standards and recently PHAC standards. This is similar to other post-secondary institutions. In March 2020, we made adjustments to our HVAC systems. So they used to be a demand-based system. Now they are running continuously. We've also increased fresh air flows into the buildings as much as possible, with weather permitting, of course. So on a day like this, bringing in a lot of fresh air is not, we are just not able to do that given the temperatures. At the University of Manitoba, we have over 100 buildings. There are some buildings in which there is no dedicated HVAC and there was on-site activity. In those areas, we've provided air purifiers. So we've purchased 56 of those total at the University of Manitoba. Across the University of Manitoba, all of our filters are MERV 8 or higher. We do not have information on each room and each classroom on the number of air changes specifically. Our staff regularly monitor and maintain the HVAC systems and filters. In fall of 2021, as a double check, we did contract with Pynchon to do some indoor air quality testing. We chose 10 locations on which to do this testing in. That was based on criteria such as the energy rating of the building. So a lower energy rating, potentially indicating an older building, and the density of activity within that building. What indoor air quality does is it measures the particles in the air. It also measures, for example, the level of CO2. As more people are in the space, there is more CO2 in the air, and then measuring the indoor air quality is an indirect indicator of air changes within the space itself. So as this was done at a time of lower occupancy across the university, this was established more as a baseline, and the plan was to redo this in January with a full return back to campus. Now, we have been able to do that in the College of Dentistry, where there are 500 people on campus daily within the dental clinics. And so spot testing is ongoing in that building. And so again, the reports that we are receiving are within the acceptable standards, and we'll continue to plan to do this again in February with more individuals on campus. And it has been, as has been the case throughout the pandemic, we are continually reviewing our approach to COVID-19. So the university has established a governance process for our COVID response within the University of Manitoba. There's a COVID Recovery Steering Committee. There are many subcommittees of this steering committee, including a health and safety committee and an operations committee. So the indoor air quality tests and reports were provided to the health and safety committee for feedback. There are experts in public health, from health sciences, from infectious diseases and science in general on this committee. And at that time, which was before the Omicron variant, no further action was needed in this area. As more discussion arises with respect to ventilation, we are in touch with the University of Toronto and looking at their air ventilation approach, HVAC approach in COVID-19. And the topic of air ventilation is tabled for discussion at this week's COVID Recovery Steering Committee on Thursday. Once I have more details on that and what our next steps will be, I'll be sure to communicate that to the Rady Faculty of Health Sciences community. And I just would like to add that ventilation is one piece of a multi-pronged approach taken by the University of Manitoba to address COVID-19. And so, as I mentioned, everyone must complete the Shared Health COVID-19 screening questionnaire and stay home. If you answer yes to any of the questions, we have medical grade masking and KN95 masks for all of our on-campus activity. Physical distancing is to be maintained wherever possible. We have a mandatory vaccination requirement with rapid testing for anyone unvaccinated on campus. We did implement that in September 2021. That is before the health system implemented their rapid testing requirement, and that will be in place until January 24th, 2022. Given the fact that at Rady Faculty of Health Sciences, we have controlled entry into our facilities, we are confident that we are catching any unvaccinated individuals and have been able to redirect them to the rapid testing sites where required. And we do have enhanced cleaning on our campus as well. So as I mentioned before, any University of Manitoba staff, faculty, and students that haven't uploaded their proof of vaccination or have an approved medical or religious exemption are not permitted on campus after January 24th. We still have a fair number of GFTs whose status is showing as undeclared in terms of proof of vaccination. I had a meeting with the College of Physicians and Surgeons of Manitoba this morning, and we are going to collaborate on trying to get this information cross-referenced and ensuring our lists of undeclared GFTs is accurate. So with faculty and staff being able to work from home as much as possible from now until February 26th, this has changed our approach to leave without pay for unvaccinated faculty and staff. And so for the most part, we will be reevaluating leave without pay for February 26th instead of implementing that leave without pay on January 24th. and it will be informed by decisions at the University of Manitoba of what in-person activity will be allowed on campus after February 26th. So in discussion with programs, college deans, and senior leadership, it was determined that all Rady Faculty of Health Sciences students need to be on site for teaching or training activities. There are no students that are completely remote. Therefore, students that haven't declared their vaccination status will be deregistered on January 24th for the remainder of the winter term. The approach to mandatory vaccination past winter term is being reviewed and informed by established governance and processes. So any individuals with approved religious or medical exemptions will be able to access the campus for essential activity with rapid testing. This will be monitored for compliance. And again, anyone in this group will receive information on how this will be operationalized very shortly. So along the same lines, any new student or recruit from an area where access to vaccination may have been limited or the vaccines are not approved here in Manitoba will be given the opportunity to start their vaccination in Manitoba for COVID-19. And while they're doing that, they will be able to access rapid testing to continue to come onto site. So as I mentioned before, Rady Faculty of Health Sciences participates in the provincial COVID-19 calls. And at those calls and through communications through HSC, we have been made aware of access to rapid testing for healthcare staff. And this includes physicians and residents. Again, we've asked if our students could be included in this as well, and also if this will be the case at all shared health facilities. So if an individual at HSC who is a healthcare staff, physician or resident becomes symptomatic and is not expected at work for 72 hours, they will be asked to proceed to the provincial testing site. If they develop symptoms while at work and area 1 is open, so the hours are there, they should proceed to area 1 for rapid molecular tests. And if they develop symptoms at work and area 1 is closed, they need to contact their clinical manager or supervisor for information on where to access rapid tests. So at the University of Manitoba, we are going to be moving away from email notifications of positive cases with on-campus exposure. So instead of sending out emails, we're going to be posting this information daily onto a website. So with public health no longer providing contact tracing, it is up to the individual that tests positive to notify any close contacts. In some instances, this isn't possible. So for example, if the individual was at a gym or in a lunch area, these emails have been effective in notifying those individuals that there's been exposure on campus. And so the website is where we'll be redirecting people. There will be a communications plan letting people know that that is changing, and more information on that will be communicated as we know more about it. Individuals are still required to notify myself of any positive cases for our internal tracking purposes. We are revamping our COVID-19 positive case reporting form. There are some data fields we are missing on there with the new requirements for notification through public health. And so as soon as those changes are made, we will make that available. And as a reminder, at the beginning of the pandemic, Rady Faculty of Health Sciences contracted with OSH. So OSH is a shared health, occupational health and safety, to do screening of our students when they were symptomatic and clearing them to return back to their placements and back to our campuses. Last week, I was made aware that OSH will be moving away from that for all staff and students. So even their own staff, they won't be doing this screening. And so therefore we'll need to take on managing that internally. So I will be revamping the flowcharts that we had when the pandemic first started, just providing advice on what to do if you're symptomatic or a close contact or needing to self-isolate. So I'll be making changes based on the most recent updated information, and we'll start using those to internally screen students that are symptomatic and also return them back to site. So university travel is still permitted for business, research, and teaching. Obviously, individuals should familiarize themselves with any isolation requirements and ensure the supervisory approval is in place before traveling. We have paused PGME electives and fieldwork placements outside of Manitoba. We are going to be reviewing this prior to February 26 to see if we can make a change there. We've also paused any northern and rural rotations above the 53rd parallel until February 26th. We are going to be revisiting this with a call for support from Ungamas Health Services related to the First Nations communities. And with any university-related travel, if there is a chance that you could be required to isolate, a discussion of the cost of those isolations needs to be considered and discussed with supervisors, especially in specific research grants. There are some allowances there, so please ensure you have those conversations before going on university travel. In fall of 2020, the University of Manitoba rolled out a remote work pilot program for support staff only. So a similar program for faculty wasn't available. This was rolled out at a time where the University of Manitoba's message was for a full return to campus in winter term. That's changed with the Omicron variant, and where possible, individuals are working remotely. So this program was really for staff that were able to work from home 100% of the time and would not need to be able to come onto campus. We received over 100 applications in Rady Faculty of Health Sciences. And I will just go over some of the key highlights. And so for the remote work pilot program, if anyone was approved, the employee would be responsible for setting up the costs of the home office. It wasn't to be an alternative to coordinating dependent care, and the agreement could be canceled at any time by either the employee or the supervisor if things weren't working out. So there's just some of the key highlights. And so we did take a centralized approach to reviewing all of the applications and approving them, just given the size of our faculty. So in order to do that, we developed criteria on which the applications were assessed. And the criteria was developed understanding that there was going to be a full return back to campus. So faculty were needing to return, academic staff will now have access to the remote work pilot program. All programming for students would be in person as well. So based on that fact, we weren't able to approve any of the applications that came forward. There was a flexible work program that was rolled out before the holiday closure and before the announcement for more individuals to work remotely for winter term. So supervisors are going to be discussing that with their staff. In the flexible work program, you're able to work from home a couple of days a week. And would not be a full-time arrangement from working from home, and is more applicable in a faculty where we are expected to be 100% back to work based on the message from Central University and the president. So our vacation carryover banks within Rady Faculty of Health Sciences for support staff continue to remain high. Last year, in recognition of the fact that there were travel restrictions and also a COVID-19, there was a one-time allowance to carry over 15 days of vacation instead of the regular 10 days. We've confirmed with central administration that this is not going to be available this year. So we did have a meeting in spring of 2021 with anyone with supervisory responsibilities for support staff and encouraged them to meet with their staff to bring down the vacation balances. So why this is an issue for us is it's operationally challenging when there are large vacation banks and requests to take that vacation all at once. That leads to overtime and other operational strains on the units. And also if an individual ends up leaving, we are expected to pay out that vacation time as well. So it is a liability for us and something we do want to manage. So we've been encouraging supervisors to meet with their staff. We've been monitoring this within Rady Faculty of Health Sciences, and we really need to get those vacation balances down by scheduling that time for employees in accordance with collective agreements and employment standards. So I'm going to finish off today's presentation with some student-specific updates. So study spaces remain open. Students can also book classroom spaces for studying after hours. Just as a reminder, food is not permitted in study spaces, masking is required in the study spaces, and physical distancing is required in the study spaces as well. Physically distanced lunch spaces are provided in the Brody atrium for students. We've had lots of questions about students that test positive and are back after their isolation And in days 6 to 10, if they're able to use that same lunch area, the answer is yes, you can. We don't have enough space to provide separate seating, nor the ability to track all of that effectively and manage it. And so individuals, students that have tested positive that are back on campus between day 6 and 10 are able to continue to use the Brody lunch spaces and are encouraged to have their lunch and remask as soon as possible during that time period. The food services remain open at the Bannatyne campus, as well as at the Fort Garry campus. The lounge spaces remain closed except for access to the microwave and fridge. Safe Walk is operational. As far as I know, Safe Ride is still on hold. Temporary parking spaces have been made available for staff and students, as permanent parking permit holders that are able to work from home are able to keep their parking permit on hold. So if there is 100% return back to campus in February, this will likely change. I've gotten lots of questions about in-person activity requests from students. So students can still continue to submit in-person activity requests to their unit lead, whether that be the associate dean, the program director, whatever the case might be. Unit leads can review those requests and approve. And just a reminder that students are responsible for acquiring the appropriate PPE for distribution. So we've highlighted that in today's presentation. That needs to be made available to anyone participating in on-site activity, even when it's being requested by students. And so any social activities, of course, are on hold until further notice, but any skills types practice or any other student activity can still be requested and approved through the units. So students must wear health system provided PPE in shared health facilities. Just as another reminder, the KN95s are not acceptable in the health facilities. So whatever PPE is being provided, please ensure that you're using that. When students are in private placements, there are instances where PPE is not being provided by the placement site. In this instance, the program will be providing the appropriate PPE based on the requirements of the site. So if the site allows KN95 masks, then those will be provided. And if not, level 3 medical grade masks will be provided. All students within Rady Faculty of Health Sciences were provided with eye protection. They must use this eye protection for any in-person activity where physical distancing can't be maintained. And of course, dentistry students in the clinical setting need to follow College of Dentistry PPE requirements. So email has been our primary means of communication with students. We try to send that same email to college deans, program leads, associate deans for multiple modes of ensuring the students get that communication. So I encourage you to please read your communication from Rady with respect to health and safety protocols so you can keep up to date with things as things are changing quite quickly. And as a reminder, there are really no more red zones in the hospitals due to the rising rates of hospitalization. So please ensure that you are keeping up to date with hospital PPE changes and acquiring the correct PPE in the hospital setting when you are there on your clinical placements. So that concludes my presentation, and I'll open it up for any questions.
I received a couple of questions by text, so I'll start with that. Are there any opportunities for employees who really enjoy fully remote work and would like to continue working remotely indefinitely? I really enjoy working for the university, but I would also like to work fully remote. Is it the university's plan that as soon as it is deemed safe to return to the office, that all employees must return, even if they would like to continue working remotely?
It's a good question, and one obviously that we've received a number of times. And so our approvals for the remote work application was based on the premise that we are 100% back to campus in the winter term. And also due to the fact that faculty would be 100% back, as faculty members were not given an option for a remote work program. And so should the university's direction on that change and there be consideration to do things remotely continuously, we could definitely take a look at that again. But for now, if the plan is to return 100% back to campus, the flexible work arrangements is probably what makes most sense. I would encourage you to speak to your supervisor about that option and see how that could fit for you.
Okay, another question that came in via text. Will we be continuing with remote learning in fall 2021? When will that decision be made if it has not already been decided?
So is that fall 2022
Yeah, I
or?
think that's what they meant. Yeah.
Okay, so a decision to be remote past February 26th still has to be made. And so that decision will be made closer to that date. And I think it's a little bit too early to tell what fall 2022 will look like at this time, but as soon as we know more, we'll provide that to you.
Okay. Another question, what specific resources are being provided so that support staff can take their backlog vacation days without the work falling on others or the work piling up until they come back?
It's a really good question. And so supervisors are managing that at the unit level. And so shifting workloads a lot around, asking for support through Rady to help with that shifting is also available. So it is being left at the supervisory level. And if within the unit that can't be addressed, there is option to reach out to Rady Faculty of Health Sciences for support.
Will there be a review for the out of province electives coming into Manitoba? Those are from medicine electives. We are receiving requests from other schools asking the elective status.
Yes, so we do plan to review it before February 26th. If there is a desire from PGME to do that sooner, we can certainly take a look at it before that date.
Okay, now from the chat, given the upgrades to building ventilation and filtration being done by other universities such as U of T and Brock, as well as the Manitoba school system, what steps within the Rady faculty, what steps has the Rady faculty taken to upgrade ventilation and filtration for classrooms and offices on Bannatyne campus? Example, local HEPA filters.
Okay, so again, very good question. I think I covered most of that in the presentation. Rady Faculty of Health Sciences wouldn't operate independently in this area. We would follow the University of Manitoba's direction and lead as informed by the COVID Recovery Steering Committee. So as I mentioned, we are in communication with the University of Toronto in their approach. They began their approach back in March 2020, just as a way of background, and they were able to accomplish what they have by working on this since March 2020. So the individual purifier units, as I mentioned, we do have 56 of them, and they have been provided in those areas where there is no dedicated HVAC in those spaces. We are looking at other strategies in this area, and we'll discuss that further at the COVID Recovery Steering Committee on Thursday, and next steps will be communicated after that.
Comment question. In my experience, screening is not consistent and often not done. How is screening or screeners monitored? Further to screening issues, when groups of people come in at a time, only one has actually swiped in, but all the others are assumed to be vaccinated.
That's a really good question, and something that we've come up with time and time again. And so it's really, you put this back to the university community to please follow the health and safety protocol. Everyone should individually be swiping in, and everyone should be waiting to be screened. So we all need to do our part, and everybody needs to be following the health and safety protocols. If individuals haven't followed the health and safety protocols, the screeners have made us aware, and we've been able to follow up with those individuals. I think we've communicated in our emails, it really is zero tolerance for not following the health and safety protocols that are being set out, and we've operated as such.
A new question, are there opportunities for residents to receive their third dose somewhere on Bannatyne campus, such as the University Health Service Clinic?
As far as I know, University Health Services is able to provide third doses. So as many of the health students know, the University Health Services, satellite location at the Bannatyne campus has not been utilized. And so they're not seeing any appointments. And so they have shut down for a short term. We have discussed offering a vaccination clinic for third doses with the college deans, and we'll be approaching the health system to see if we can put that on. We've done several vaccination clinics. We led the first COVID-19 vaccine clinics in the province, and so are well versed in how to do that. And so we can definitely look into what can be done there.
Where can I get information on the latest positive cases in the gross anatomy lab of Basic Medical Sciences building?
So we don't currently list them by location on our website. They are just aggregate reports. Going forward, though, when we do move away from the email notifications, you will be able to access that information on the website. We will provide information as soon as that's set up. So if you're looking into the past of the positive cases in gross anatomy lab, that will be through the email notifications that have gone out where there's been on-campus exposure.
Another question, can you review if any visitors, for example, drug reps that come on site, do they need to provide proof of vaccination in advance?
Yes, not in advance, sorry. They do need to provide proof of vaccination when they enter. So anyone that doesn't have swipe card access can only enter the facility through Rady Center. And at that point, if the screener knows that the person hasn't swiped, they will check their vaccination card to ensure that they are fully vaccinated and take them through the screening questions.
Will students who test positive be required to notify any patients they may have come into contact with during the communicable period, or will there be Rady support for this form of contact tracing?
So when you're in the health facility and in full PPE, that is not considered to be a close contact. If there is an exposure, that's all handled through occupational health and safety. So they would be contacting the patients. That wouldn't be a requirement of the student. That is not changing. There are many changes that are coming forward from the health system with respect to screening, as I mentioned. So I'm going to confirm that, but as far as I know, it'll be the occupational health and safety department within the shared health facilities that works with Manitoba Public Health on that piece related to patients.
For obtaining PPE for research, does central procurement refer to the EPIC purchasing system?
So as you know, in Rady Faculty of Health Sciences, we haven't required each of the units to acquire their own PPE and pay for it. That's been funded centrally through Rady Faculty of Health Sciences. And so continue to do that so that you don't have to provide a FOB at this time. So reach out to Rady Faculty of Health Sciences operations as you have been to request that PPE.
Next question, where are the temporary parking spaces? And maybe how do you access them? That might be helpful.
So I would encourage you to contact the parking services office. They'll be best to advise. It just depends on where the permanent parking holders have put their passes on pause. Essentially, they've been able to work from home, and I don't have access to that information.
Another question regarding remote work. Will you consider offering the remote work pilot program again and review applications on a case-by-case basis?
I'm unsure of what that looks like for the future because we don't know what will be the case after February 26th. So if we're all back in person, then I don't think we would revisit the criteria that we established before, as we had said no to those remote work applications before. That would likely still be the case. If the university changes their approach after February 26th, then we can definitely circle back to see if that criteria still makes sense and is applicable and move forward from there. But again, the flexible work arrangements will be made available after February 26th as well. So I encourage you to reach out to your supervisor. They did receive this information, but there's been lots going on, and they did receive it very late before the break, and then we switched to remote. So they will be in touch with you about speaking about those flexible work arrangements. And again, that is for support staff only.
What if we have N95 masks we purchased individually? I believe those are medical grade. If I choose to provide my own, may I wear those?
So when entering the facility, you will need to change into your level 3 medical grade mask. I do encourage you to use the PPE that is being provided in the facility. As I mentioned, there are different types of masks out there of different qualities from different suppliers. We do have a process of vetting the masks that are coming onto and being used within Rady Faculty of Health Sciences. So I would encourage you to use the provided PPE.
Next question I'll answer. It was about whether or not the presentation will be can be shared, and we have it being recorded, and so we will post it on the website. Next question, has campus card access been removed from people who haven't declared, as they can gain access to the campus prior to the screeners getting to their post at 7 a.m.?
Yeah, it has been removed.
What advice do you give to instructors if a student in a teaching space is not wearing a mask appropriately or refuses to wear one?
So there is university guidance that was established, and we can circulate that broadly. So essentially, there is a slide that's developed that each instructor should be posting in their presentation at the beginning of the class, reminding everybody about the health and safety protocol. Students have been informed that there will be no eating within the classroom, but people can have a sip of water and briefly remove their mask to be able to do that and remask right after. So if the instructor sees someone is not wearing their mask, they're asked to pause and just ask the individual to just remind people that there is a masking requirement. And should that continue, there is a process by which security would be called and they would address the situation. The class would be ended, and then that would be dealt with in that matter. The specific process has been communicated though, and I'm going to share that through to Rady Faculty of Health Sciences, so you have it.
Some students have not been able to swipe into Brody Center over the weekends when coming in for OSCE prep. What should students do to gain that swipe access, or could it have just been a glitch on those days?
It could have been a glitch. Those card access readers are probably not designed to take the amount of swiping that is happening on them right now. So I encourage you to try again. And if not, like if you're able to access during regular hours, you should be able to access on the weekend as well. If you continue to have problems, reach out to your program contact and they can help you get that swipe card access.
Okay, next question. How are undeclared GFTs or nil salary staff, where did this go? How are undeclared GFT or nil salaried staff contacted for proof of vaccination? These individuals may not be checking their U of M email.
Yeah, definitely. So we did receive a list of everybody within Rady Faculty of Health Sciences with an undeclared status. The list was very long, over 3,000 records. Did not tell us which program, which department the individual was from, or even their role. And so we took a lot of time to build up that data and broke it out by department and by unit and shared it with your department heads and your managing directors and business managers. We asked them to reach out to the GFTs and nils specifically and gave them the option of those individuals submitting proof to them directly. So sending a picture of their vaccination card front and back, and we would upload that on their behalf. So they didn't have to fuss around with the university systems and not knowing how to get access because they hadn't remembered their password or whatever the case might be. And so we're going to continue on with that work. So we have updated lists now, and we'll share that with the managers and directors to continue to get those numbers higher and that data more accurate.
Great. Next question. How many positive rapid tests were identified at the point of rapid screening since the start of rapid screening program? Do you have this data for the Fort Garry and Bannatyne campus?
I do have the data. I just don't have it on hand. I can tell you it's definitely less than 10 total.
Next question. Are we looking to move away from the president's direction of everyone that is able to work from home do so? Come at the end of February. I'm not sure what that's.
Oh, is the question, I think the question is, are we going to continue to work from home for the rest of winter term?
Yeah.
I don't know. So as I mentioned, there's going to be a decision made closer to February 26th on whether there'll be a return or whether we'll continue to work remotely.
For those of us who rent office space on campus but are not U of M staff, how can we register our vaccine status? We do not have U of M accounts to use the online system.
So there was a process rolled out to allow non-University of Manitoba staff that are on campus to upload proof of vaccination. So if you didn't receive that, you can contact me and I can assist you with that. So as we have tenants on our campus that are not University of Manitoba employees, there are lease agreements with these individuals. And so non-University of Manitoba employees that are on our campuses and have lease agreements are not required to follow the University of Manitoba mandatory vaccination policy. Many of them have their own. So for example, we have Health Sciences Center within our facility and CRIM and Research Manitoba who all have their own policies, which are similar to ours. And the guidance for tenants within the University of Manitoba facilities is that those individuals can be within their office spaces and be unvaccinated, but in our common spaces, should they need to access them, for example, bathroom facilities, things like that, they can't be there for more than 15 minutes before they need to return to their space. There is no monitoring of this, and formal communication on this is still going out. As we're mostly working from home, we haven't sent that out yet.
And that question was from someone from Research Manitoba, they said, and that they haven't received any further information since November 2021, but.
Okay, just connect with me and we'll go through that process.
Are there any other questions? Just check my text. There's a few more questions that came in via text, so I'll read those. Okay. How long is the flexible work arrangement available until?
It'll be definitely available for the rest of winter term, and any information on that will be made once more decisions about coming back to work versus working remotely are made.
And then the second part of that question was, is there a deadline for applying for the flexible work arrangement?
There isn't.
Okay, a few more questions have come in now on the chat. Is there a plan in place for when there is a fire alarm or emergency?
This came up when the COVID-19 pandemic first began, with limited individuals on campus. And the Environmental Health and Safety Office did meet with fire wardens at that time and units. So we will circle back to them to see if there's any updated information and plans. But as far as I know, there were plans put into place for limited people being on campus, and the fire wardens for the units not necessarily being on campus.
Okay, I think this is the last question. Who is monitoring potential cluster outbreaks in Rady and informing the units?
So as you know, anytime there's a positive case in our campus, it does get reported to me. We work with public health in getting advice on how to manage the situation. And they are also helping us assess if there's been any outbreak situations within the University of Manitoba. I can let you know that in Rady Faculty of Health Sciences, there have been 0 outbreaks reported. And again, we work closely with Manitoba Public Health on that.
Okay, I think that concludes all of the questions. So thank you everyone for coming and for participating today. I'm Ilana Simon, Director of Communications Marketing, Rady Faculty of Health Sciences.
Thanks, everyone. It was nice seeing you all. Have a good day.